Good morning, or good evening, or good afternoon, whatever time is it, wherever you are. It's a really good day, another good day to talk to you. And the topic I'm going to talk about with you today is schizophrenia. And I've been wanting to talk about this topic for a very long time, and for some reason I missed this topic so many times. But this is very interesting, intriguing, and it's very important to talk about. Uh, let's start slow, and let's start with basic things like what is schizophrenia, what is it all about, and how it emerges in people, and what are some conditions or some symptoms or some signs that can tell you that it's schizophrenia. uh, Before I go any further, please do let me know if there is any problem with the voice, or if you can't hear me, or if any kind of problem you're facing. Do let me know, and I'll try to fix that problem. So, without any further ado, let's start talking about schizophrenia. Okay, so schizophrenia is a very serious mental condition, and it affects people in a lot of different ways. It depends on how serious that condition is, and how far that man or female is with that condition. So let's talk about what schizophrenia is. Now, schizophrenia is a condition where a very serious condition, in fact, where a person feels or loses this sense of. I'm really sorry about this. Can you please tell him that just give us a few minutes, 15 or 20 minutes maybe. Okay, so it's a condition where people behave differently than usually we see people. And in a short description, if I say, when a person loses touch from reality, that is what schizophrenia is all about. If you loses your touch from reality, and if you're outside the reality, then it is the condition is called schizophrenia. Now, this is a very distressing and disturbing situation. If somebody is in this situation, he is suffering heavily. There's a lot of toll on his mind, and it's a very difficult position to be in. uh, and not unlike any other disorders. If you, for example, if you're going through autism, ADHD, bipolar, or these kind of disorders, you can still function in one way or the other in society, and you can go to school, or you can go to you can behave in the society. But in schizophrenia's cases, like these kind of cases, you can't function properly in the society, though it affects your role in the society very heavily, and it's really, it took a toll on your personality, it took a toll on your performance in the society. If you're going to school, you're a teenager, or if you're above teenager, you're an adult person, it affects you really hard. So when a person who's going through a condition like schizophrenia, uh, he loses his touch from the reality, and it can be distressing for him or her, or for the family and friends. And it usually varies from one person to another person. So we cannot be certain about these facts, and we cannot be certain about the symptoms or signs if and we cannot make a correct assumption about it. Like, one person may behave differently than another person. And a friend of mine has just joined us in the room. That what makes me smile, not about the topic. I'm not speaking about the topic. Okay, so we cannot say anything certain about this. Like, we cannot put in a circle, in a box, like these are the symptoms which are for schizophrenia, and it will apply to all of the people. No, it doesn't work like that. So it varies from person to person, from personality to personality. It differentiates. If we have to put, just for your understanding, if we have to put it in categories, so schizophrenia is basically have three categories. Now, the first category about schizophrenia is the first category in which schizophrenia falls is called, I forgot about it. Like, basically there are three categories of schizophrenia: negative, cognitive, and one which where people fall in delusions. So that category, the first psychotic break you have, is called psychosis. In psychosis, you have delusions, and there are hallucinations and delusions. There's a bit difference between hallucinations and delusions. So this is the first phase of schizophrenia, which we call psychosis. In psychosis, you either have delusions about something. For example, the reality is something else, and you believe in something else. Now, these things are called delusions. For example, you might think that there are people out there who want to kill you, or the people who are speaking on TV or radio stations. You think differently about these kind of things, or you start believing in aliens. I'm not saying that believing in aliens is somehow a psychotic break or something like that, but just you behave, no, you do not behave normally. So, and talking about hallucinations is when the person sees, hear, or feel, even touch, or even taste. If we taste differently and something which is not there, that is what hallucinations is. It's not like if you feel something differently, it's something when you feel and it's not there in reality it is not there. So as I said before, that losing the touch from the reality, that is what all this schizophrenia is about. So if you feel, or if a person feels, touch or hear something, that thing is not there, that is what called as hallucination, and this is the first stage of schizophrenia, hallucinations. So there's a bit difference between hallucinations and delusions. Now, there are two other conditions in the first category called psychosis, that is thought disorder and movement disorder. Now, thought disorder is that if you can't manage your thoughts process, and you jump from one thought to another thought very quickly, and think the way you think or a normal person thinks is illogical, or you do not use proper logics, or people go with thought disorder may have trouble organizing their thoughts and speech. Sometimes a person will stop talking in the middle of a thought and jump from one topic to another topic and make up words that have no meanings, just making words along the way he's talking or she's talking. Movement disorder is when a person exhibits abnormal body movements. People with movement disorder may repeat certain motions over and over and over again. These are the first four things which is important, and these can give you a very early sign if a person is going through schizophrenia. Now, the most important thing about schizophrenia is that usually, not all the times, but usually it occurs when you are around in the later years of your teenage and the start years of your adulthood, like somewhere around 16 to 30 years it appears in people. And if it's not diagnosed or intervention doesn't happen in the early stages, like after the first psychotic break or of the first condition, then it will be very difficult to stop it somewhere. To treat it, to make it normalize, or to make the people, to make it easy for the people to live in a society as normal people do. So it's very important for you to realize that normally it happens between the age of 16 to 30, but it's not a rule. Just normally it happens in this age group. And not only that it happens in this age group, when you first have the psychotic break, before that people usually start hearing different voices and start seeing things which are not there, and that's how it happens. And if he or she get help from after the first case, then most probably the person can be treated. The second stage of schizophrenia is negative symptoms. In negative symptoms, basically in a general understanding, negative symptoms, you just get negative about everything. You don't have the motivation to do anything, and you just lose the motivation, and you lose interest in everything, or you don't feel any kind of enjoyment in daily life or in any other task you might want to do. You see this withdrawal symptoms from social life, difficulty showing emotions, and difficulty having functioning normally. Negative symptoms include having trouble planning and sticking with activities such as simple as it could be grocery shoppings, and having trouble anticipating and feeling pleasure in everyday life, talking in a dull voice, and showing limited facial expressions, avoiding social interaction or interacting socially awkward ways, and having very low energy and spending a lot of time in passive activities. In extreme cases, a person might stop moving or talking for a while, which is a very rare condition, and it also has a name called catatonia. These symptoms are sometimes mistaken for symptoms of depression or other mental illness, but it does fall in the area of schizophrenia. You just lose complete interest in social life or in any other activities of the life, and you don't feel any kind of motivation. And not just the motivation, you do also stop showing your emotions and you stop participating in the life. The last one is cognitive symptoms. Cognitive, as by the name it goes, cognitive ability. You start losing the functionality of your cognitive abilities. All things which are related to your cognitive ability, you start losing that things. It includes problems in attention, concentration, and memory. These symptoms can make it hard to follow a conversation, learn new things, or remember appointments. A person's level of cognitive functioning is one of the best predictors of their day-to-day functioning. Healthcare providers evaluate cognitive functioning using specific tests. For example, having trouble processing information to make decisions, this is one condition. Having trouble using information immediately after learning it, and having trouble focusing or paying attention. For example, if you tell somebody that he needs to pay this bill, so he'll just stop functioning and he won't know what to do with that information. There's a very important thing with this schizophrenia cases, and usually people ask about this question, and I've seen a lot of people asking about this particular area of interest, and on different videos and different articles, and that is risk of violence to that person's him to that risk of violence to himself or to anyone other. That is a very important thing. Usually people are the schizophrenic people are not violent, and they are not danger to themselves or danger to the society, but some extreme cases there's a possibility that they become a threat to themselves or to other people. Overall, people with schizophrenia are more likely than those without the illness to be harmed by others. For example, people with schizophrenia, the risk of self-harm is more prominent to harming other people, and violence to others is greatest when the illness is untreated. That is one important thing I've told you before, that if the illness goes on and if it is untreated and there isn't any intervention in between, then things get serious. It is important to help people who are showing symptoms to get treatment as quickly as possible. You can just imagine that if somebody is seeing something which is not there, things could go wrong in a very dangerous way. So if somebody is hearing something which is not there, if somebody is seeing something which is not there, and they start to act on it, then things get complicated and it become a very difficult problem. Usually people make a mistake, also another make mistake when they are talking about schizophrenia or when they are dealing with schizophrenia is mistaking it for another disorder which is called dissociative identity disorder. Now dissociative identity disorder is something else. Although some of the signs may seem similar on the surface, schizophrenia is not dissociative identity disorder, which used to be called multiple personality disorder or split personality disorder. There is a lot of movies and a lot of literature on this particular subject. You can for just talking about in a different way, some extreme representation of these topics are like movies like Split, Samuel L. Jackson movie, Glass, and Night Shyamalan's movies. These are some of the examples of these conditions. People with dissociative identity disorder have two or more distinctive identities that are present and that alternatively take control of them. I've told you that there's a very good example of these conditions. The conditions are movies like Split, Glass, and these kind of movies. They have a very good representation of these conditions. Multiple. It used to be called as multiple personality disorder. Now it has changed to dissociative disorder. What are the risk factors of schizophrenia? There are several factors that may contribute to a person's risk of developing schizophrenia, and any other kind of disorder. The most important is the genetics. It's not your fault. It's not your fault if you have any kind of a disorder. Most likely it was in your genetics. So not like you start to blame your parents, but it does fall under that pretext. Schizophrenia sometimes runs in families. However, just because one family member has schizophrenia, it does not mean that the other family members will have it, or of the family will also have it. Studies suggest that many different genes may increase a person's chances of developing schizophrenia, but that no single gene causes the disorder by itself. So there is no definite science, there is no definite answer for this. So if you are wondering about it, or if you are worried about it, stop wondering about it. There is no answer there. The second most important factor for schizophrenia or for any other disorder, but most importantly for schizophrenia, is environment. We have talked about autism and ADHD and different other disorders, and for them the most important thing or most important factor about them was genetics. But for this particular disorder, schizophrenia, this particular condition, environment is a very important thing, and sometime it not just what you call it an important factor that initiate this, or but sometimes it triggers the emotions which later on developed into schizophrenia, which later on transformed into schizophrenia. Research suggests that a combination of genetic factors and aspect of a person's environment and life experiences may play a role in the development of schizophrenia. This means that somebody might have a gene of schizophrenia, but it might not activate throughout his life. There's a possibility that it never activate in his life or triggers in his life, but because of the environment, those genes can get triggered, those genes can get ignited. Brain structure and function. Research also shows that people with schizophrenia may be more likely to have differences in the size of certain brain areas and in connections between brain areas. Some of these brain differences may develop before birth. Researchers are working to better understand how brain structure and function may relate to schizophrenia. Now, in the last but not the least, let's talk about the treatment. How is schizophrenia treated, or how it can be treated? This is a very important question. Usually people, after understanding schizophrenia, or if somebody is going through this condition, or if somebody's loved one going through this condition, they ask this question and they are very eager to know about this. Current treatments for schizophrenia focus on helping people manage their symptoms, improve day-to-day functioning, and achieve personal life goals such as completing education, pursuing a career, and having fulfilling relationships. Antipsychotic medications. Now, as I've told you before, that all of these things that I'm telling you about, or I'm discussing with you, they are all research based. They are not. I'm not a medical professional, so do not take my advice. Do not take anything which I say to you as a prescription or start doing it. If you are going through this condition, if a loved one of yours is going through these conditions, talk to a medical professional or a medical provider, and he will guide you further. I'm just giving you a general information to make a better understanding of these things, and so we can help each other. Antipsychotic medications. Antipsychotic medications can help make psychotic symptoms less intense and less frequent. These medications are usually taken every day in a pill or a liquid form. Some antipsychotic medications are given as injections once or twice a month. If a person's symptoms do not improve with usual antipsychotic medications, they may be prescribed clozapine. People who take clozapine must have regular blood tests to check for potentially dangerous side effects that occur in 1 to 2% patients. So this is important for you. Psychosocial treatments. There is also psychosocial treatments. Psychosocial treatments help people find solutions to everyday challenges and manage symptoms with attending school, working and forming relationships. These treatments are often used together with antipsychotic medications, and the people who participate in regular psychosocial treatment are less likely to have symptoms reoccur or to be hospitalized. Now there's a few other options, which is education and support, and then coordinated specialty care, and there is also assertive community treatment for drug and alcohol misuse, and there are all of different kind of thing. Now you might ask, there's also different kind of therapies which can help you with schizophrenia, so you can also check about those things. Now the last question is, how can I get help for schizophrenia? You need to look around, mate. you need to ask for you need to ask to your loved ones, or if your loved one is going through the condition, then you need you have to make him understand, or you have to seek professional medical help. So if you or anybody around you is going through this condition, or any other condition, or any other condition that you might feel that needs assistance, or you think that it is not normal, or it is something which could harm him in any way, you need to get you need to get help. Ask for help. Asking for help or asking for a hand is no big deal, is not something which you should be ashamed of. Like any other thing, people get sick and they get treated. So similarly, if you have a problem up there, or if you're having a problem with your emotions, or any kind of problem you are having, or any kind of difficulty, just go ask somebody. Ask for help. Ask for a handout. Okay, that's it for today. I think let's sum this up. Thank you so much for being with me, and for bearing with these. I know these topics might sound boring for some of the people, but we have to talk about these things. It is very important that we talk about these kind of things. Okay, what do we have here?
Can psychosis cause brain damage or cognitive decline?
Okay, we got a question that can psychosis cause brain damage or cognitive decline? Can the person return to the same abilities? Can the brain repair itself? Now these are very good questions. These are very good questions. Another question is schizophrenia dangerous for people? Dangerous for people around us? Okay. Let me come to the second question later on. The first was very important. Can psychosis cause brain damage or cognitive decline? Can the person return to the same abilities? Can the brain repair itself? One at a time. Can psychosis cause brain damage? There is no specific science about this, so we cannot say this for certain. I've read a lot of research paper about this, but cognitive decline, yes, it does happen. The cognitive decline is one of the first part of the symptoms. For example, when we talk about the third one, in fact, the first one is the second one is negative, the first one is psychosis, and the third one is cognitive. In cognitive area, all the things which are involved, which are related to cognitive brain, cognitive functioning, it get affected because of this schizophrenia. So yes, you or anybody who is going through schizophrenia, they might have a cognitive decline. Not necessarily, but they might get cognitive decline. Can the person return to the same abilities? Now, when we talk about disorders, or when we talk about these mental challenges, it's not a illness. Please keep this in your mind, that these are not diseases or illnesses that you get cured of. These are challenges. These are conditions that you work. Then you try to work with these conditions, or there's a complete chance that you have all of these conditions, and you still go through your life quite comfortably, or well, life is not comfortable, but still you function quite properly, and you function all right. Your functioning is okay, and you might have a different kind of a condition, but your functioning is good. So it's not about being cured, or it's not about being treated. It's about getting help, and it's about dealing with that condition. So I think your question is like, you want to see that if it can be helped. Yes, it can be treated, it can be helped. The last one, can the person return to the same abilities? Okay, yes, they can. Can the brain repair itself? Yes, all the brain can everything repair itself. The human body is designed that way. The God has designed us that way, but up to some extent. If it is if the intervention was in early stages, yes, it can help you. The brain can repair itself, or you can get treatment from the medical professionals, and the outside help can also assist you. But if the intervention was late, or the diagnosis was late, then the intervention was late, and then the treatment was late, obviously that makes things very difficult. Thank you so much for your questions. And is schizophrenia dangerous for people around us? I've already talked about this one. Usually people have this kind of a perception. It is not a necessary case, but sometimes it does happen that people become dangerous to themselves or to other people. Thank you so much for your time. Take care. Bye bye.